Looking at priority two, and just to reset it, and I'm reading this in light of some of the recent announcements that came out around some of the new programs that CMS has launched. And so for priority two, it's assess causes of disparity within CMS programs and address inequities in policies and operations to close gaps. And so when I look at this, I think it absolutely speaks to what you were saying, right? We have a wealth of data. How do we make sense of it? Because we really have to take it to that 30,000 foot level to understand what's going on. There was a lot of talk around populations, right, that may be on the uh, more of rural areas, tribal communities, right? So looking for ways in which they could address challenges. I think one of the other things I thought was important in priority two is that CMS talks about, you rapidly addressing when they recognize that there's challenges. And we saw that, right, in some of the changes that came out from ACO REACH last month. And so they addressed those quickly. But some of the other changes I know that they're noting in this new ahead model are around potentially extending the waiver, right, for telehealth, not requiring video. It looks like audio only would be an option, changing scope of practice for some of our practitioners. And so I think about all of those things in light of this priority too, again, of, being able to address some of the causes of the disparities. And I agree with you. I think that lack of data, lack of having that, we talked last time about making sure to have it on the individual, but then how do you also then have it at that 30,000 foot level, speak about it from a population standpoint, and then also be able to bring it together to run programs.
Yeah, these are all great points. And I think these racial disparities are so prevalent and right there in our face. But we really need to document them now with the help of these codes and also discover these disparities through our algorithms, machine learning, and having the structured codes will definitely help in there to develop benchmarks against different populations, like you mentioned, which are marginalized. And these are very serious problems. Now we're going out of the medical realm into these non-medical realm. And I see this as a bigger challenge than just population health or CMS models. How do we treat a person now that we know this sensitive information? What are the tools? It's not just the EMR, it's not just the realm of what we typically think of as health or medical problem. Now we are going to treat the whole person. And we know that is critical. But this is a game changer. This is really the new world. You need new tools. You need ways to capture this information. You need to leverage whatever tools, whatever data you have to bring that to a collaborative team and to do it at a population level to look at these patterns and then to match resources at a macro level and then respond to the patient at the micro level. So this is a game changer.
I totally hear you. And I love how you put that together. And that's exactly too, when you read over, the document, they talk about, holistic care and
Mhm.
recognizing that you really have to look at the whole patient. And when I look at this in juxtaposition, right, with other legislation and other programs that are coming out, couldn't agree more. That new ahead model. I know I keep referencing that, but it's
Mhm.
just, it just recently came out. The idea of constraining hospital budgets, looking at total cost of care, right? You're not going to be able to manage total cost of care and hit benchmarks there unless, right, you're treating the whole person because all of these other factors, all of this sensitive information. I know we've been talking about the new Z codes that have come out around social determinants of health, right? Understanding someone's background and how they grew up, deeply personal information. How do you take all of that, keep it protected, use it to treat that whole person? And in a way that, it's not just saying, hey, I'm dealing with it, but actually having it demonstrated, right? Come out in being able to control for cost, improve patient outcomes. So there's all these ways in which it has to show up in the data in order to illustrate, right, that you're truly making a difference. So, to your point, it's about getting that story, working at the individual and the population level, but then also too working in a way that actually has visible proof, right, in the data of how we're improving healthcare overall. I think is going to be a significant challenge. And I know AHEAD only deals with a few states at the moment, but I definitely can see it cascading into others pretty quickly. And so it'll be interesting, to see how things unfold with all of these different initiatives that are coming out these days.